Welcome to the Jazzy Eyes podcast, taking care of your vision with expert precision. Here's your host, Dr. Laura Falco.
Hello, and welcome everyone to episode number 2 of the Jazzy Eyes podcast. I'm your co-host and producer of the show, Jeremy Wolf, and I'm here with none other than your host, Dr. Laura Falco. Dr. Falco, how are you today?
I'm doing well. Thank you. Good to see you.
Yeah, likewise. And I'm excited to get into this topic today because, as you know, I have 2 small children, not so small anymore. My daughter just entered middle school, so 9 and 11. And I'd like for you, I think it would be useful to talk a little bit about some tips now that the kids are going back to school, some things related to Eyecare. Talk a little bit about that, and then we'll kind of go from there.
Yeah. So I think it's really important to understand that although they do check vision when you go to the pediatrician's office, and some pediatricians actually have some devices that do an estimate of a prescription, that's one part of anybody's vision is visual acuity. So there's a statistic out that says about the screenings miss about 75% of the kids who really do need glasses for school. So the screening is one part. It's just acuity. And if you've watched kids do it, there's a stationary chart or they look into a box and they can kind of squint and there's letter recognition. And some kids are very smart. They read it with one eye and they've got it memorized for the other eye. Because many times I've seen a kid need glasses really for one eye. So I keep changing the chart, but in a pediatrician's office, it's the same chart on the wall. Now, I'm glad they do it. It's one more thing for them to check off, but I don't want anyone to confuse like a screening of vision that you might get in a doctor's office for a full vision examination that we would do at any optometry and a lot of ophthalmology practices as well. So there's that first part that's vision. So that's just your acuity. Is your child 20/20? Are they 20/30? Are they 20/40? Are they 20/200? Can they only see the big E? Or, are they 20/25? And sometimes a kid doesn't have to be 20/20. You can have a kid in the first couple grades where the work is in front of them, the writing on the board's quite large, and maybe they're not 20/20, but that's okay. And they can still get through school and do everything that they need to do. It's different than adults who are driving. But there's a couple other things that we do that I wanted just to kind of go over that you won't have done unless you're having a full eye examination. So the first one is binocular vision. So you might refer to this as eye teaming. That is our eyes working together. So there's something called convergence where the eyes, when you read, tilt down a bit and turn in a bit. Now, that's normal. Some kids don't turn in enough. Some kids' eyes turn in too much, and their eyes are working way harder than they need to be. There's other tests that we can do that will check tracking. So tracking is how efficiently your child is going to move their eyes left to right. So where do you think, obviously, this would affect a kid? Even from second grade, first grade, second grade, spelling, reading. That's huge. In third grade, your kids are really starting to work independently, have homework assignments to read. So when your child's reading a book, are they understanding what they're reading? Do they have to read the same sentence over and over? At what point should they not be using their finger, to track left to right? And should there be efficient tracking of the eyes moving in a left to right fashion? So again, these are things that wouldn't be tested in other offices that we're going to take a lot of time and sit with the kids to check, to test. There's also, it's called accommodation, but it's focusing, right? When you hold a chart in front of a child for small print up close and you ask them how far down can you read on the card, and even an adult, when it takes about 3 seconds and they look down at the card and they read the letter, that's great. But it's very different when you want a child to attend and to read for 30 minutes, 20 minutes versus 1 minute. So sometimes a kid can hold their focus for 1 minute, but to hold their focus on the page appropriately for 30 minutes, they can't, right? So what would that child start complaining of? So maybe they don't know. Oftentimes they don't really know how to put it into words. I don't want to read. Can I watch the movie? I want to listen to it. Let's say your kid understands it audibly. They're processing it, but visually they're not processing it. So what if that's because it is so straining on the eyes for them to sit there and try to track left to right? They're having trouble hold their focus. So they're getting a headache. They want to close their eyes. They just don't want to do it anymore. They don't really know why, but it hurts them and it bothers them, and they can't explain why to you. So I joke with the parents and the kids, and I was like, if you don't come in here having a headache, you leave my office having a headache, because I sit there and do all these different tests, and I'm making things double on purpose. I'm seeing how long it takes for patients to get it back to single when it breaks into double. All of these little things are really, really important to let you know how your child is functioning visually, not just, oh, they're 20/20. Like, that's a very small piece of the overall back to school, like, are my kids set up for success when they start, third grade, fourth grade? And that's where it starts. But, my child is in college, so I'm super aware that they're on the computers and the screens in school, right? It's not like, you can't be one of those, oh, there's not going to be any screen time when you get home kind of a thing, because your kid's going to fall behind, right?
Yep.
So they have to go on Canvas. They have to log in to get their homework. There's no textbooks, right? It's evidence-based learning. So they have to look up the facts they're trying to get, and then they have to upload their homework. And it's screen time the entire time, and it's focusing at this near point. And then what I always tell parents as well is, what I think is interesting is, so when somebody of my age, which is not super old, but I've been out from college for 25 years, 30 years, but when we're done on the computer working, I think a lot of us shut the computer. Like, we can't wait to shut the computer, and however we're going to wind down, whether it's TV, are we going to walk the dog, what are you going to do? When these kids wind down, they minimize one window, but continue to stare at the device. Just maybe they're winding down with a video game. Maybe they're winding down on YouTube. Maybe they're winding down on TikTok. Like, where I feel like, of our generation, we kind of can't wait to shut the screen off and look far away. They're still attending here. And where I'm still somebody who wants a TV to watch a movie, they'll watch a movie on their device. They'll watch a movie on their phone, on their iPad, on their screen, which is keeping their focal point right up there, like right there. They're not getting a chance to relax their focus for far and give their eyes a break, even though they're not concentrating. Maybe they're concentrating more, who knows? But it's different. The way they use their eyes and the way we do is different. So it's really important to check not only, visual acuity, but how this kid is doing with their eyes up close after prolonged work.
Yeah. I mean, God, you touched on so many good points there. And I think it's more important now than ever to make sure that we're getting our kids checked out regularly. Like you said, with all the screen time, constantly on these devices.
Yeah.
I got to imagine that, if a child is struggling and you don't get that issue resolved or addressed quickly, it's probably going to regress quicker than it would be otherwise, if they're squinting all the time and putting additional strain.
Right. Well, and a good analogy is like, they can get through the day, but maybe they're not achieving like you think they should be, and I tell patients, you can get through your day if I put a 10-pound ankle weight on each leg of yours and told you to go through your day, right? Like, you could still do it. But wouldn't your legs be so much more tired at the end of the day? So some kids, without these glasses for up close, without these glasses, to help them doing their tasks, it's like they can do it, but they're pooping out earlier. They're more tired. They're more cranky. They're shutting their eyes after they read their book in their room, and they don't want to do anything. And because it's taking 110%, it shouldn't be that difficult. Now, sometimes I should say the answer is a pair of glasses. Sometimes it's not. There's plenty of times that I send out a patient to vision therapy. Because if you think about, like, the kid's brain is like a black box, right? So you have input. So we have to make sure the image is coming in clearly. we're getting a bit of the processing. Are they tracking properly? Are their eyes teaming together properly? And are they holding their focus appropriately? But then there's a whole thing in processing that goes on in the brain as well. What are they doing with that information? And then what's the output? If you're a test question, what's their answer? Like, can they achieve what they need to achieve that day? So we're fortunate that, being that I was at Nova too, is that they have a huge binocular vision department. There's other private doctors that do, there's few, but there's a few in the area that we can make referrals to, because sometimes the answer isn't a pair of glasses. Sometimes it's something called vision therapy.
I was going to ask, please share. I'm curious
the
what that
child
is.
The child is taught how to use their eyes more effectively. They have to wake up their focal points. They have to wake up their ability to focus. They have to learn how to converge. Their eyes go together, diverge to relax their eyes. And when my child again was in third grade, I noticed that she was skipping lines and she was using her finger, and we were rereading and we were getting frustrated. And anyone who practices knows you cannot examine your own child. It's a disaster. So I could not examine. It was futile. I couldn't examine her. So I had this funny feeling. She at the time was smart enough to get by. So she wasn't flagged in class. It was me noticing. And that's oftentimes the way it is. A lot of parents are like, something's not I don't like the way she's reading. Something's not working. Oh, but her grades are fine and she's where she has to be and she's grade level. I'm like, yeah, I'm not buying it.
Something's off here.
Yeah, something's off, right? So she went in for an eye exam with a really good colleague of mine at Nova, and he came out and said, she's a hot mess. Like she was all over the place with, the tracking, like here. And I said, I knew it. So she did vision therapy, probably 3-4 months. And it hurts. Like, just if you had physical therapy and you sprained your arm or you hurt something and then you had to rebuild the muscle. So she had to learn how to track more effectively, left to right. And it's monotonous and it bothered. And she complained, and there was slamming doors and there was crying and there was fighting, and that's about right. It happens. And then she gets into fourth grade. And then there was an essay about, like, what was something significant that happened to you that was good, in third grade. And she wrote this entire essay, how vision therapy was the best thing she ever did, and how her eyes was. Meanwhile, the fights and the crying and the screaming that we endured. So it does work. Somewhere in the recesses, they know what they're doing helps them, even though sometimes when you're going through it, it's one more thing to make parents crazy. I get it. I've been there. But, it was one of those things that I knew she needed. And sure enough, like, she's a voracious reader now. She reads super, super fast. It helped her stay on track, not have to reread the same passage over and over and over, but get through the paragraph, understand what she read, because she wasn't losing her place and it was disjointed, So it helped. It helped a lot. But so there are things that you can do with your child, that can help it get better, even if it's 2020 and it's not just simple glasses. But again, these are things that, unfortunately, I don't usually see until the kid is really complaining and the parent is at their wit's end, and they're like starting, we're just going to check everything. They have headaches, what's going on? And it's one of the main things.
Yeah. And, I'm guilty. I'll be the first to admit. And now that I'm glad we're having this conversation, because of this discussion, I'm bringing my 2 kids over to see you together. No, it's been a while.
Yeah.
And everything seems good enough, but they're on their devices all the time. And I don't know. So I hope this raises awareness for other parents out there to make sure that they're taking their children in frequently to check these things out, because life happens, right? Everybody's busy, and vision can be one of those things, not like get your annual checkup at the doctor. You could let that go by the wayside and really neglect that if you're not careful. So,
very, very and I don't think kids put 2 and 2 together. If they think they can see, they don't know that there's more to it, that could be the reason why their head hurts, that could be the reason why they're not understanding what they're reading. And then it's a self-confidence thing. And it snowballs. And the reality is, as much as everyone, vilifies the devices, they're endemic, and the kids have to be on them to stay competitive in life. And when they go, when they're going to go to get jobs, they can't not be computer savvy. That's not an option.
Yeah,
so
it's a necessary
like it or
evil
not,
nowadays.
I'm not saying give a 3-year-old an iPad in a restaurant. I'm not saying that. But when they're in high school, junior high school, they are going to be on these devices for all of their work. And it is what, and so basically we have to, what can we best do to keep their eyes healthy, to keep them comfortable, while and successful while they're in school. So these are definitely some things that most people don't think about. Just because your kid can see clearly, there is still more to check.
All right. Anything else you'd like to share before we wrap up here? I think we got a lot of good stuff out there.
My associate is gonna, we kind of divided some of these topics. So I took these topics. She's gonna talk a bit about blue light protection, myopia control, some of the other things that may be a little sexier that you've heard in the news lately. I did kind of like the tried and true, what other kind of things that but I explain it on a weekly basis to patients, and I think patients are always happy to understand. Oh, that's why, that makes sense. I get it, and to be honest, these are not just things that happen to kids. This is just one more thing because it's back to school. But all of these kinds of conditions I check for on many, many patients, even if they're not heading back to school.
Dr. Falco, always a pleasure. And you will be seeing me and my children very, very soon.
Sounds great.
You better hold my feet to the fire if I don't show up there. I need you to contact me because this is really important stuff. So, all right. So everybody, thanks for tuning in, and we will look forward to seeing you on the next episode of the Jazzy Eyes podcast. Everyone have a wonderful day and take care.
Take care.
Thank you for listening to the Jazzy Eyes podcast. For more information, visit jazzyeyes.com or contact 954-473-0100.